Without further ado, thank you everyone for joining us for today's translational seminar series. We have Alice Zhang, Marcia Goodman-Hinnershitz, and Bonnie Kent. They're going to be presenting today on Not Just for Snacks, Smart Vending Machines as an Innovative Method to Address Community Health Needs and Health Disparities in Central PA. So it looks like recording has started. So just a brief introduction to each of our speakers. Alice Zhang is a family medicine physician and assistant professor in the Department of Family and Community Medicine at Penn State College of Medicine. She completed her medical school at University of Maryland, Baltimore, and her family medicine residency training at Lancaster General Hospital in Lancaster. Most recently, she finished a primary care research fellowship and obtained a master's in public health at Penn State College of Medicine. Her clinical experience in treating substance use disorder has motivated her to find creative and innovative ways to deliver treatment and harm reduction items and services to those who need it the most. She has a passion for addressing health disparities and public health needs, conducting community-engaged research, and reaching the underserved. Marcia Goodman-Hinnershitz is the Director of Planning and Resource Development at the Council on Chemical Abuse, Berks County Single County Authority. Following her graduation from Penn State University, Marcia served as Child Protective Services Supervisor. She obtained her Master of Social Work at Temple University, and for 30 plus years, she has assumed a variety of roles at the Council on Chemical Abuse, first as the Prevention Program Manager and currently as the Director of Planning and Resource Development. Throughout her career, Marcia has assumed a leadership role in the implementation of a variety of initiatives, including student assistance programming, tobacco prevention and cessation services, gambling prevention projects, and most recently, opioid prevention initiatives. Marcia follows the public health model of community empowerment to ensure that services are responsive to local needs. And last but certainly not least, we have Bonnie Kent, who works for Dauphin County as the Operation Manager and Community Liaison at the Northern Dauphin Human Services Center. She also serves as the chairperson for the Northern Dauphin Salvation Army Unit, which is also located in the Human Services Center among 18 other agencies. Bonnie has been serving Northern Dauphin residents in human services for the past 37 years. She has been working alongside Penn State Health and College of Medicine for the past 12 years in various programs and events. Bonnie is a member of Penn State CTSI and has assisted Penn State Scope medical students to implement their first pilot program in Northern Dauphin, which continues to provide access to healthcare for underserved communities. So we welcome the three of you, and we are so excited to hear more about this project. So I will turn it over to you, Alice.
Perfect. All right, let me start my share screen. All right. So today I'll be talking about our project about using vending machines, not just for snacks, but as mentioned, as a way to address community health needs and health disparities. So I'll be the first in a trio of speakers. And I also do want to also acknowledge the other co-lead on this project as well, Alexandra Zazerska, who's been a great mentor and obviously the other co-lead on this project as well. So this vending machine project has been ongoing. I guess the discussions for it at least has been ongoing for some time, at least 2 years. And the beginnings of this began around COVID time when, as many of you may be aware of, the rates of fatal drug overdoses were rising. This happened in Pennsylvania, but also nationwide as well. And what really kind of motivated us too was the opportunity for, missed opportunity for intervention. So in Pennsylvania, nearly 6 in 10 fatal overdoses had an opportunity for intervention. And notably, bystanders were present at 30% of these overdoses. And so what if these bystanders had naloxone, a life-saving medication, on hand? This picture might look very different indeed. And so this was the kind of the crux of what motivated the vending machine project, was that we have the tools to save lives. But how do we get them to the community? How do we get them to those who need them most? And more importantly, how do we connect them to treatment? And so as mentioned, this conundrum and others spurred the notion or a discussion of using vending machines as a non-stigmatizing, low barrier way to deliver these health items to the community to improve health. And obviously harm reduction and substance use disorder is one big component of community health, but community health can mean many different things. What are the benefits of using vending machines? Well, first, they're available 24/7, and that certainly has appeal for when businesses and other services may be closed, so at night or on holidays, on weekends. The vending machines are also anonymous, so you can avoid in-person interaction. And during the pandemic, I think we learned the importance of distancing and trying to still provide care. And it can also reduce stigma as well that can be associated with some of these items and conditions. These vending machines are also flexible and customizable, so we can put different items in the vending machine based on what the community might need, give lots of different items as well, depending on whatever issue may be affecting the community. So we saw potential within these vending machines in that they might be able to increase engagement among hard to reach vulnerable populations, be able to bridge gaps in care unmet by traditional programs, and also just in general increase accessibility of items and services needed by the community. But as some of you may have heard through news reports, vending machines are becoming very popular throughout the US as a means to dispense naloxone. This is just a brief, some news articles that came out probably actually earlier this year of vending machines that are happening throughout the US. So this is a vending machine out in San Diego. This is a vending machine in Kentucky that was actually emptied out on one day after opening. Another vending machine in Wisconsin, in Milwaukee. This vending machine is in Indiana, outside of a hospital. And then also, of course, in Philadelphia as well, in Pennsylvania. And this was actually almost a year ago, more than a year ago, this vending machine was placed. So there's a lot of buzz and lots of different types of vending machines being placed throughout the country. So I'll talk a little bit about our pilot study that we're conducting in central Pennsylvania with our vending machines. And so the goal of our pilot study is to put in place quote unquote smart vending machines into the community as a way to reduce health disparities and promote health. And this is actually a mock-up of what our vending machine would look like with the name. The name we chose with community input is Health to Go. As well with the logo as well. And so this is what the touchscreen, and as I'll go into more detail about that, and also the wrap as well. So I made mention of smart vending machines as the type of vending machines that we'd be putting in. So what exactly are these smart vending machines? So one of the key features is that they have a large interactive touchscreen in the front, kind of like a very oversized iPad placed on top of a vending machine. And it's also connected to cellular and Wi-Fi connection. So the combination of the two allows for playing of videos on a screen, conducting a needs assessment and collecting data from the user's interaction with the touchscreen, providing real-time alerts across the screen as well. So if there's an emergency or an increase in overdoses or some other public health messaging that needs to be urgently spread, we can have the ability to do that. And then it can also provide connections to treatment, social services, peer recovery coaches as well. The vending machine also has a cloud-based data collection system that can provide us data on what items are being dispensed, what services people are clicking on, and also on a practical matter when items need to be restocked. And so while naloxone is one item that we're hoping to dispense from our vending machines, as mentioned, there are many other items that we can include and that we're planning to include in our vending machine. In our first iteration, we're hoping to put in HIV self-tests, condoms, both internal and external condoms, menstrual kits with period pads and tampons, hygiene kits with toothbrushes, hand warmers, washcloths, wipes, drug checking strips for fentanyl and xylazine, medication disposal bags, and I might be missing a couple others, but that's kind of the big overview of what we're hoping to put in for at least our initial iteration. And as mentioned, beyond dispensing items, these vending machines can also connect people to treatment and services and support as well. And this is done through the touchscreen. It can display a map of local resources categorized by different categories, so addressing the social determinants of health as well. So we can connect them to healthcare, we can connect them to shelter, housing, food, clothing, and whatnot. And then finally, too, the vending machine can collect data on usage, and then also the users can answer questions displayed on the vending machine. And I'll go a little bit more into detail about the data evaluation component of our project. For our pilot study, we have 3 locations that we're hoping to get these vending machines launched in the near future. The first one will be in Harrisburg, outside of the UPMC ED entrance. UPMC was also a partner and provided some funding for the vending machine as well. Harrisburg is an area with lots of community needs and also a high proportion of African American population in Harrisburg as well. Our second location is going to be in Reading. This will be inside the Reading YMCA, and also, like Harrisburg, a location with a high community need index score, but also with a different demographic as well, with a greater Hispanic and Latino population in Reading. And then finally, our third location would be a little bit beyond a little bit after the Harrisburg and Reading ones, will be one in Millersburg. And the location is still yet to be determined, but this will be definitely a rural location with less access to healthcare and some of the services as well. So as mentioned, we are hoping to collect some data and evaluate our pilot study as well. And so this is an example of some of the data that we will be able to collect. Actual data comes from vending machines that are in place in Canada, similar smart vending machines. So we'll be able to get some data on usage of like what time of the day the vending machine is being used. And as evidenced by this graph, this particular vending machine is being used after hours, so from 4 p.m. to midnight, and also midnight to 9 a.m. when most services are closed. We'll also be able to get some information about what items are being dispensed, but also what items are being viewed. So the blue lines are items that are being viewed, and then the dotted lines are items that are actually being dispensed. And this could provide us some interesting information too about maybe items that people have a lot of interest in, but for some reason they're not clicking the dispense button to get it. So for example, if someone is looking at drug checking strips, and there's a lot of interest in drug checking strips, but not a lot of it getting dispensed, that could give us some more information to dig deeper as to why that might be happening, whether it's more education as to what it's being used for, or more outreach with the population. And as mentioned too, we can also add or have survey questions on a touchscreen, and these are customizable that the users can answer. There'll be a multiple choice format. There'll always be a decline to answer or skip option, but we can ask questions about their demographics, about their healthcare access, whether they've accessed or used naloxone in the past, experiences with overdoses, and also, what items they are satisfied with, if they're satisfied with the vending machine, any aspects they would like to change, and also perceived impact as to how the vending machine might be influencing, the community perceptions or whatnot. We're also having the users register to obtain items from the vending machine and be anonymous user ID, but That way, we're able to get some more information about for example, user demographics, and also track users over time to see what items they're obtaining. And this could give us an opportunity to ask some follow-up questions. So if they obtain the naloxone one visit and then they come back, we can perhaps ask in a survey question, we noticed that you got naloxone last visit. Did you use it to reverse an overdose? Did you give it to a friend? Do you still have it? Just to get some more information. And we're also hoping to complement the quantitative data that we get with the vending machine survey questions and the data with some qualitative data through interviews and focus groups, primarily with stakeholders, but also trying to reach those, the users and those in recovery and those using substances. But these interviews and focus groups will, look at ways to improve the vending machine user interaction process, maybe perceived avenues of impact, and also general experiences that they may hear from their clients about the vending machine, feedback and whatnot. So basically ways we can make the vending machine more usable. And with the pilot study, we're going to start to look at potentially vending machines' larger impact. Of course, we're not expecting with 1 or 3 vending machines that there's going to be a huge impact, although it would be nice. But we'll start to look at kind of local public health metrics that we can use as hopefully more and more vending machines are being placed on the ground, that we can use later on as a measure of evaluation. So whether it's this naloxone administration by law enforcement or EMS or overdose responses or law enforcement arrests. And then also too, we are hoping to compare our data with some international data as well. So these vending machines, particularly the smart vending machines, they are being placed across Canada. They're hoping to put about 100 of these in the next 2 to 3 years. They are primarily focused on HIV self-testing, but also including harm reduction supplies. So we're hoping to compare our data with theirs, in addition to many of the other vending machines that are being placed throughout the country as well. I do want to emphasize that in this vending machine project, it's been a community engaged process from the beginning and ongoing as well, because we do want to make sure we develop a intervention in this vending machine to be responsive to the community needs and also reflective of what they would like to see within the vending machine. So in implementing and trying to get these vending machines on the ground, we partner with many different community organizations, health systems, community members working with those in recovery, those who are those experiencing homelessness, and also the general community population as well, in addition to academic institutions, healthcare organizations. So a wide variety of community partners who've been helpful in designing the vending machine. And this is just a sample of some of our key community partners who have been involved with the project. And in particular, we'll highlight or hear from 2 of them, one from SOS Berks and then also Dauphin County as well. So I'll turn it over to Marcia at this point to talk about our current implementation efforts, specifically focusing on Berks County and Reading.
Okay, thank you very much. And just to give you a little perspective of Berks County, we are in the southeastern corner of Pennsylvania. Interestingly enough, the city of Reading is the 4th largest city in Pennsylvania, and we have a high density of Latino populations of all different ethnicities. So we have a coalition. If you could slip to the next slide, please. We started this coalition about 7 years ago as a response to the opioid epidemic, and it was led by our county commissioner at that point, Kevin Barnhart, and our SCA director. And we formed the SOS Berks Opioid Coalition. And if you can see by our logo, where you see the anchor, we see ourselves as an anchor in the storm of addiction, how we can bring together everyone, and SOS meaning saving lives. So we have over 60 community stakeholders involved who've joined, and each of them comes from a different perspective, brings different gifts to our coalition. But our investment is to educate our community about the disease of a substance use disorder, raising awareness about stigma, and providing information about the many resources available for prevention, treatment, and recovery. And we find, even though as providers we have a whole array of resources, a lot of times people don't know what they are. Next slide, please. So when Dr. Jennifer Murphy from Penn State University, as a member of the SOS Berks Coalition, she came to us to discuss the concept, knowing that the SOS Coalition had a very refined structure that allowed us to move forward with innovative ideas. So our structure is we actually have 6 different subcommittees, and each of them is tasked with a different component of addressing the opioid epidemic. And so all of the committees have been involved in some way in the Health to Go kiosk vending machine. First of all, the coalition is committed to harm reduction, and it's committed to really pushing the edge about what kinds of strategies we use to address the harm and reduce the harm of substance use disorder. So the first issue we needed to look at is understanding where the problem was at. Berks County is a large county with rural, suburban, and of course our urban core in the city of Reading. So we have a data committee that looks on a monthly basis about data with overdoses, both fatalities and people that are admitted to the ER, and was able to pinpoint where the epicenter in Berks County was. Not surprisingly, it was in the city of Reading, but we were able to actually look at where within the city, and we wanted to be able to ensure that we had resources that were located. We started out with some street outreach and in the 8th and Penn area, which is Center City. But as we looked at the Health to Go vending machine, we looked at where could it be located, and the YMCA, which is basically at 7th and Washington, was really an area where most people could access resources and where there was the greatest need. Once we selected the location, we then looked at how we could move to implement. And we had both our community safety and community awareness committees involved in all components of the planning, both outreach to our community partners, looking at the fact that we needed to have everything available in both English and Spanish, and also relevant in Spanish, so we use the right language in promoting the products. And then we needed to look at the selection and the placement of the products. A lot of us, thanks to the work of Smart One in Canada, were being able to understand how you package these items for a vending machine. It's been an interesting journey, but we know a whole lot more about vending than we did when we started out on this. And then, of course, how to create informational resources. One of the areas that we've worked on is the creation of short videos in English and Spanish to explain how to use the products and to also address the stigma. Okay, next slide. So you look at this and you look at the technology that's involved in this and you say, this isn't going to be easy. And I think we all started out with this very optimistic, how are we going to make this happen? But we knew we also were going to have a lot of hurdles. And I want to be able to thank the team, because we've been very good at being able to figure out what the barriers are and being able to look at how we can best address those barriers. So our initial plan was to have the vending machine available by this past spring. But what we learned very quickly is, first of all, this is a research project. So if you're doing a research project and you're working with the university, you have to go through the IRB approvals because you are collecting data from subjects. So that was one of the first hurdles, but because people knew how to address the systems, we were able to do what we needed to do to be able to work that through. The other thing that happened in our process is there were elections. And when there's elections, there's change in leadership, so that we had to be able to look at how we could, as we promoted this project and got the buy-in, how we could continue to get that with new leaders, new stakeholders. Okay, so that was, again, a barrier we all have to go through whenever we're doing our work. The other interesting part that happened during this process was that there was a legalization of fentanyl tests. And really, we like to call them fentanyl checking strips and other drug checking tests. So when we started this project, they were not legal. So we could not have put them in the machines. But fortunately, the law was changed in Pennsylvania. So then we had to revamp our process. First of all, how do we distribute them? And then how do we get the supply? And all that was been resolved and addressed over this past year. So now we have sufficient number of not only fentanyl testing or checking strips, but also xylazine checking strips to check people to see whether there's xylazine within their drugs. And along with that legalization, there was stigma attached to that because a lot of people don't buy into the fact that it's okay for people that use drugs to check their drugs. And so we needed to work with the stigma and be able to educate people about why it's important to have these checking strips within the vending machine. At the same time that this was happening, FDA also approved over-the-counter use of Narcan, which sort of changed how we were going to be distributing the Narcan. Interestingly enough, something I never expected is how Narcan is packaged was changed so that the packages were larger, which impacts on how you put them in the vending machine, something we all needed to learn, how you package them. So those were just little obstacles. But I think the one that I found the most interesting is finding the right location. So how do you approach the community about a new technology, a new way of dispersing information when they don't understand the whole concept? So we looked at who could be our possible community partners, and then how could we educate them about, yes, we want you to partner as a location. So the first site that we approached was buying into it at first, but as they became more familiar with it, there was a sense that this isn't going to work. And we recognized that and accepted that as this maybe wasn't the right partner. But fortunately for us, the YMCA of Berks County and its location in downtown Reading was eager to be able to be a partner. And if you look at what our YMCA does, it really is the ideal spot. First of all, they have about 1,000 people coming in and out of their facility in a month. And these are folks from people that use their gym facilities to people that come there for meetings. But more importantly, they also provide housing, transitional housing and services for people that are unhoused. So they have homeless folks coming in. They also are open 24/7 after 11 o'clock p.m. You do need to ring a buzzer, but they're fully accessible 24/7. So it was an ideal place. And interestingly enough, in their lobby, they have a location for many of the traditional vending machines that vend food. So it was an ideal place to, okay, we're going to put another type of vending machine in this location. So whereas some of the other locations are more connected to health services, our location is really a social service hub for the city of Reading, and we feel will be the ideal location. Thank you.
All right, and I think we'll shift next to Bonnie. Hopefully, is the audio working okay for you, Bonnie?
Can you hear me?
Yep.
Yes. Okay.
Good.
Perfect.
Okay, we can go to the first slide. Good afternoon. I'm happy that I could join you today. I've been asked to share our needs in Northern Dauphin and how the smart vending machine will impact our community. So first, let me introduce you to Dauphin County and Northern Dauphin. Dauphin County, highlighted in red on this map, is one of 67 counties in the state. There are 286,000 residents in the county, and Northern Dauphin, which is highlighted on the Dauphin County map on the right, outlines our boroughs and townships. This rural area consists of 272 square miles It takes 3 hours to drive the perimeter of our service area. And I know that because I give tours to professionals who are interested in learning more about our culture, our needs, and how they can more readily serve our communities. We have about 30,000 residents living in 11 communities or several valleys, as we refer to, because we are surrounded by mountains. We are far removed from many services, especially healthcare services. In the shaded area below, you can see Harrisburg on the left side and Hershey on the right. Those areas provide our closest hospitals, a good 45 to 50 minutes away. We also travel that distance to get to our after-hour care or most of our specialty care providers. Next slide, please. This is the Northern Dauphin Human Services Center located in Elizabethville, which is the hub of Northern Dauphin. Dauphin County Commissioners have coined us as a one-stop shop of services, and our center will celebrate 15th year anniversary in January. You can see our agencies listed and the multitude of services for families, seniors, veterans, support services, case management, counseling services, food services. You can visit the community health worker or meet with OVR to assist in finding employment. We've also morphed into a community center with lots of volunteer opportunities for empowerment for our community members. This could be adult literacy programs or a prosperity center. Volunteers could be working in the community garden to provide fresh produce. And the volunteer opportunities are endless. We help with back to school shopping and Project Promware. We really engage the community in a wide variety of ways. And the one-stop shop with its variety of services and community opportunities to work together is so important as it allows us to serve more effectively and efficiently. Community members then become aware of the needs in the community and how they can help their neighbors in need. It's a great service model. We have much work to do as we have many barriers and gaps of services to work on through our community: hunger, unemployment, and homelessness. We average 25 homeless or near homeless situations per month. Our nearest shelter is in Harrisburg, but many of our community members are intimidated by the different culture and will not go to Harrisburg for help, so they continue to be homeless. Our homeless population will be well served by the smart vending machine, which may be offering bottled water, food, hats, gloves, and so much more. Next slide, please. Transportation is one of our largest gaps of services. There are no set bus routes for mobility within Northern Dauphin, no taxis or a working Uber or Lyft service. We have one bus, which is referred to as the work bus, and this bus picks up early in the mornings en route to Harrisburg and returns early in the evening. We have a share ride program that serves senior citizens and persons with disabilities, but we lack public transportation programs for all. And our gap of services is for those that are 59 and younger without a disability. We lack accessible specialty care and after-hour care. We are also limited to local providers who take medical assistance or new patients. Our last set of data showed that we have 6,080 people receiving medical assistance. We also show that we have transition and mobility on the rise. Where do our new residents go for care? And affordability impacts many who cannot cover cost of medicine, co-pays for care, food, personal hygiene products, and the list is long. Our service area is surrounded by beautiful mountains, but they seem to be a barrier to many residents who refuse to travel outside of the area. And some state that they're intimidated from what they don't know, like knowing where to park, operating a digital parking meter or parking garage, which we don't have here. Navigating an unknown area and the cultural differences, it is overwhelming when traveling in multiple lanes of traffic with aggressive drivers, and this adds to the anxiety they may feel already. Northern Dauphin has 1 in 4 families living 200% or below the poverty level. A few indicators of our poverty is that in our 4 school districts, 50% of the student body are eligible for free and reduced lunches. Several years ago, when we offered programs which offers free tax preparation programs through United Way, we learned that the 61 families we served averaged an annual gross income of $13,800. This made our communities the lowest annual gross income of all the United Way sites they served. Our many local food pantries serve large numbers of families. For example, the food pantry here at our center normally serves 375 to 400 households, and they are one of 10 pantries in Northern Dauphin. And as we listen and learn from our community members, we learned this. One year at a free community holiday meal, we had a young girl share her excitement as she received a toothbrush at the event. She said she was so happy because she no longer had to share a toothbrush with her brother. Sometimes we don't know what we don't know, but we can learn from our community. A smart vending machine can really help our community members who are financially struggling with needed items like hygiene products. Next slide, please. Excuse me. Engaging our community is imperative to be successful with services and to impact on health equity and disparities of health. 12 years ago, Jim George with Penn State Operations joined our Northern Dauphin Health Initiative. And 7 years ago, Dr. Krasniewski and Dr. Wadsworth engaged us in conversation in ways we could work together and shared the great work of CTSI with us. It was a good day for Northern Dauphin. In March of this year, we were grateful to Penn State, CTSI, and CERC, who hosted a community-driven research day in Northern Dauphin so we could discuss our community concerns and gaps of services, as well as available resources. This event led to a partnership with Penn State and Dr. Depa Shakur and the Lakens Valley Children's Museum, who worked to implement a community readiness program. It also opens doors to networking more collectively. That also was a great day. The collage of pictures on the right is one of many, many events offered by Penn State Scope throughout the year. Scope, an organization developed and operated by first and second year medical students, provide access to healthcare to underserved populations. Scope provides an opportunity at these events to connect and learn of need directly from our community members while offering health screenings and educational opportunities. Scope uses this information to plan future events. Scope makes our community members feel heard and cared about and have a direct impact in our community. And Scope can provide dialogue with our community on what is needed in the smart vending machines. We have been truly fortunate to work with Penn State Health and Penn State College of Medicine, CTSI, CERC, CHAIR, Scope on many levels, and with many organizations to provide education, connect our community to resources, and provide opportunities for health equity as we take measures to impact on health disparities. The smart vending machines will provide accessibility at any time of the day and provide not only products, but also resources, and it will be helpful in collecting data to help focus on areas of need in the future. We're looking forward to our smart vending machine arriving in Millersburg in 2024. And in the meantime, we continue to engage our community members, engage community readiness. This includes creating awareness that the machines are coming, educating the community on how the machines will work, and asking community members what necessities are needed so we are meeting the needs in the community. We're grateful to have our area chosen as a recipient of the smart vending machine and look forward to continuing to support and value the great work of Dr. Zazurka and Dr. Zhang. Thank you.
Perfect. And so that is, in summary, our brief presentation on smart vending machines as an innovative way to reach underserved populations, reduce health disparities, and improve community health. Just want to give some acknowledgements to some of the co-investigators on this study, as well as our funding sources as well. And I'll just leave the floor open for questions, thoughts, comments. Our contact information is also below if you ever wanted to reach out to us personally as well. But I will stop the screen share so we can see people's faces, I suppose, and go from there.
If you have questions, please do feel free to unmute yourself. If you don't want to do that, you're welcome to drop your question in chat.
Alice and Marcia and Bonnie, thank you very much for not only presenting, but also being very, very, very active members of the team. This is, I think, very remarkable part of the what I view as success of the vending machine project, even before we have vending machines on the ground. So thank you. My question to you is, and I know ins and outs, so I will not ask about current ins and outs, but what do you foresee to be the biggest challenges going forward after we finally successfully put the machines on the ground? Like, are there particular worries that you have or concerns that maybe would be helpful to discuss and see how we can troubleshoot in advance?
I can start with some of my concerns. It's interesting, and I spoke with our team, and I apologize. My dog has decided he wants to join the conversation, but I have a background through family who operated vending machine a company in Berks County, and so I know the challenges of maintaining the machine. So I think, the greatest challenge is really planning on how we're going to make sure that that supply is always there for people, that whenever they go to use the machine, they're going to be able to get what they need. And just planning with that with our partners at the YMCA, I think it's going to be a new experience for this. The other interesting challenge is to be able to make sure that our targeted audience is aware of the machine and that they're feeling comfortable with it. So my thoughts on that is we're going to have people that work at the front desk at the YMCA. They need to be very informed about how the machine operates, so any questions can be addressed with them. And then also to be able to encourage people to come to the machine so they just don't look at it and say, what is this? So I was thinking of having like tours of different social service agencies, bringing consumers to the machine, having little field trips so people could start learning to use it. And then by word of mouth, they can spread it to their friends so that more people are aware of it. So it's so different from anything that we've had that I think it's going to take some time to really plan for the implementation once the machine finally arrives to Berks County.
Thanks, Marcia. And yeah, I think I echo some of the sentiments as well. I think one of my main concerns is the supply, making sure we have the items available. I think one of the earlier slides I presented was a brief news article about a Narcan vending machine in Kentucky that was empty like the first day after it was launched. Granted, it was a different type of vending machine and a little bit different circumstance, but that's kind of my fear or thought is just what the pattern is going to look like. And I think only time will tell to see what kind of stabilizes. There might be some initial excitement, maybe not initial excitement. So it'll just be it'd be interesting to see how the community receives it and how we can make sure the items are in stock. Our Canadian partners have mentioned that some incidents of vandalism have happened when they want an item, the item's not there, they get frustrated, and the frustration is taken on a vending machine. So has implications for the safety of our vending machines as well.
I have a question.
Go ahead.
One of the, hopefully what will help us is the fact that these are very different compared to other machines. These are smart vending machines. And I really want to emphasize, well, what we hope is a true smartness, which means that we can track the supply online and remotely via cloud. So it's not like a human has to be there to check how much Narcan is still left. We can see it as it gets dispensed. So we could track it hypothetically minute by minute. We are hoping to do it day by day, though.
So you had mentioned that you'll be collecting data for research as well, and I'm sure going through IRB has been fun for this project. So two questions. One, is the intent to consent everybody who receives the product from the vending machine into your research study for data tracking? And if so, how do you plan on addressing the issue that people aren't always willing to participate in research, but they still need those services? Is there an option to opt out?
That's a very good question. So we're hoping to keep the registration. So like backtracking. So there'd be a registration process to use the vending machine. And then we're hoping to also ask questions as well. And so the consent would be tied more to their survey questions. And so they would get, go through the consent process to then answer survey questions. And so that should hopefully help with some of that component as well, if I'm understanding your question appropriately.
So they'd be able to register without consenting. They can still get products just by registering, but then there would be a later step to do the survey questions, and that's where the consent will be.
Correct.
Got it.
They are consenting to use the machine, not the survey. So the registration offers a consent to use the machine, essentially.
Okay.
Yeah, but the surveys are not mandatory, so there's no requirement to complete the survey to get an item.
Got it. And if so a follow-up question, if a person comes up and they see that consent to use the machine, or they even see, a Penn State logo, some people are afraid of large institutions, are you going to have a pop-up that says, here's where to provide or where to get these medications, where to get Narcan if you don't want to get it through our vending machine? Is that something that you've thought about?
That's something that we haven't thought about, but could consider putting in, especially if we start seeing a lot of people not going through the consent process or registering. I think at that point we might need to stop and reevaluate and see if there's, for example, another way to give them the items, or maybe do some more outreach to make the vending machine not as scary, or kind of tailor and tweak the process.
Yeah.
And I think one of the points in designing the wrap for the machine is when we really originally started, it looked more Penn State centric, but our design now has helping hands with the Penn State colors, but it's not that you are identifying as being part of an institution. I also think that, at least for the machine in Reading, it's good that it's located next to other vending machines that are for food products. So it's not as stigmatizing as, oh, this is just, for harm reduction products. And the other thing that I believe, and Alice, I think you can agree with me, is that we know that Narcan is something that we want people to be able to access immediately without going through any registration process. So there will be a way, if they need Narcan for an emergency, that they can get that directly just by clicking that button, that will come right out of the machine, that they don't need to log in or do anything.
Thank you. That was very helpful.
Bonnie, and I think that you are worrying concerns like the troubleshooting part, and I know because it takes so long to troubleshoot, I would like to start sooner rather than later.
Yes, and to excuse me, answer your initial question about concerns, the one that I would have is that we're a small knit community and everyone seems to know each other, can link you. I call it playing dot to dot. Ask a couple questions and all of a sudden, like, I babysat your dad, kind of thing, right? And so people are very guarded because of that. And so I think we'll have a little bit of work to do in making people feel comfortable when using the smart vending machine. And I think key is to really engage the community in conversation, educating them, and then also having them be invested by helping us decide what needs to go into the machine. And I think that will open doors for many. I think another thing to really focus on is where the location of the machine will be. So somewhere that is more discreet, a more private location, but accessible at the same time. And so in Millersburg, it's a smaller geographical area, but a large population because we have a lot of apartment complexes there. And, you know, I think centralizing that location of the machine is really important. And reducing any stigma that may come with that, some concerns that people may have in what's in there, by having them be part of the process at the beginning, I think will be key.
Yes, because there's consideration of privacy versus our concern about, I think the highest risk for the machine is being vandalized, where we always worry about it. So like there's this tension between these two needs.
So we're considering the laundromat, thinking that may be a good location. But yeah, so we have a lot of work to do, and we're excited to work with you on this. And we thank you for this opportunity.
All right, well, if there aren't any other questions, I'm happy to give everyone 8 minutes back in their day. So Alice, Bonnie, and Marcia, thank you so much for sharing more information about this project. And we hope to see everyone on a future translational seminar series next month. And happy holidays to everybody.
Happy
Thank
holidays.
you. Bye-bye.
Happy holidays. Thank you for having us.
Bye.
Thank you. Bye-bye.